about the descending tracts. Typically, the descending tracts are divided into the pyramidal tracts, which are the lateral and anterior cortical spinal tracts, and the extrapyramidal tracts, which are the two vestibular, two reticulospinal, tectospinal, and rubrospinal. This is somewhat of an arbitrary differentiation because you'll see that they all pretty much work during voluntary motor activities and some involuntary motor activities as well. But this is a typical clinical differentiation. The cortical spinal tracts are axons of the upper motor neurons, which originate in the primary motor cortex, the motor association cortex, the primary somatosensory cortex, and the anterior cingulate gyrus. They descend longitudinally in the internal capsule and the cerebral peduncle. They descend longitudinally through the pyramids of the pons and medulla and terminate on the lower motor neurons in the spinal cord or via interneurons which relay to lower motor neurons. The lateral cortical spinal tract comprises about 85 to 90% of the cortical spinal fibers. They cross at the midline in the pyramidal decussation of the caudal medulla. They then descend in the contralateral lateral funiculus. Of those fibers, 55% of the axons will end in the cervical cord, 25% in the lumbosacral cord, and 20% in the thoracic cord. The anterior cortical spinal tract are the smaller contingent of uncrossed fibers which descend in the ventral funiculus. The majority ends in cervical spinal cord. Both pathways tend to end on spinal interneurons or directly on lower motor neurons. These descending axons from both parts end on both on the alpha and gamma motor neurons to produce alpha-gamma coactivation to maintain force of the shortening contractions, which we call concentric loading mode. The axons of the cortical spinal tracts are somatotopically organized. Neurons in the primary motor cortex are arranged so that neurons which innervate muscles of the lower extremity, of the upper extremity and face are more ventrolaterally positioned, and those that innervate the muscles of the lower extremity and trunk are more dorsal medially positioned in the motor homunculus pattern of the primary motor cortex. Their axons then rotate as they pass through the corona radiata. In the internal capsule, these axons descend through the posterior limb of the internal capsule, with the axons which eventually will innervate the face and arms being more rostral, that is, closer to the genu, and those that innervate eventually the trunk and legs are more caudal. In the cerebral peduncle, those axons which carry information destined for the upper extremity and face descend more ventral medial, while those that carry information destined for the lower extremity and trunk descend more dorsolaterally. This relation is maintained in the pyramids as they pass through the brain stem. In the lateral cortical spinal tract of the spinal cord, these axons ending in the cervical spinal cord on lower motor neurons, which innervate the upper extremity, tend to descend more medially, and those that go further are progressively more lateral, as illustrated here, with the most lateral innervating muscles, innervating motor neurons in the sacral spinal cord. The anterior cortical spinal tract mostly ends on the cervical spinal cord.